Dr. Josh here. I just had an amazing interview with Dr. Nayan Patel on the role of glutathione in helping people with Alzheimer's or other chronic conditions. Definitely, you're going to want to stay tuned to the very end for an amazing story about his father living a full life using glutathione and other approaches. And for me, the top points of the interview were: number one, you should be using glutathione every day of your life if you're over the age of 50 or have chronic medical conditions. Number two, glutathione is safe and effective. Number three, there are many different ways of delivering glutathione, including the topical approach, putting it on your skin. And number four, there are no true allergies to glutathione. It's a natural substance like water, and it's very safe. So I hope you enjoy it, and definitely leave me some comments below if you liked it. This is such an honor today. I'm with my friend, Dr. Nayan Patel, who is the world's expert on glutathione. And I talk to my patients every single day about glutathione. So let me tell you more about him. So for 30 years experience, he has a doctor of pharmacy from USC. I believe it's University of Southern California. And he adjunct faculty still at USC, and he has written an amazing book called The Glutathione Revolution, and has done research in this field for decades. I could spend 10 or 20 minutes just introducing him. So with your permission, I am going to, because I want to spend the time asking you questions. So without further ado, Dr. Patel, thank you so much for joining us today.
Oh, appreciate that all the time. Thank you very much for inviting me today.
Yeah. So as you know, my focus is on reversing Alzheimer's. Now, glutathione is very important for other chronic conditions besides Alzheimer's. But let's just start with the basics. So what in the world is glutathione, and why is it important? Why have you devoted your career to it, and why are we talking about it today?
Absolutely. And if once I knew what it was, I think everybody should be interested in that as well, because after water and air, the most abundant molecule inside our body is glutathione. And so everybody should know about this thing by now, that if you're not making a dent in improving your glutathione levels in your body and improving those things, you're missing a whole boat on it. And that's why I devoted all my life on it, because 140 years we have known about glutathione. Nobody figured out how to actually get inside your body, inside your cells, bypassing all the barriers we have that the roadblocks that the body has set up for us, and how to get through that whole process and get inside. And once I cracked that code, it's just a matter of time when people get to experience this miracle. And so I'm devoting my life now is just on education and public interest and knowledge, improving the knowledge as much as possible, so that way they get to benefit as well. So in a nutshell, it's a tripeptide. It's a very small amino acid chain, 3 amino acids coming together, making a tripeptide. Most abundant molecule produced in the human body, affects tens, if not hundreds and thousands of different chemical reactions inside a body. And the reason that I got very impressed is because I looked back and I saw that the top 10 leading cause of death in the world, top 10 of them. One of them is accidents. Let's take the accidents out of there. The other 9, they're all linked to oxidative stress, which is actually can be nullified by glutathione.
Right, including Alzheimer's, which is my focus, and that's why I'm so glad. And I've heard you on the main stage at presentations to hundreds or 1,000 different physicians. I love that you've devoted your life to this molecule and to spreading the word. And literally the joke was, I would see you at every single conference. you're exhibiting, you're spreading it. So you're this is not just like in the back room or in your lab or what have you. You're out there like myself to the public explaining this. So as you said, glutathione is simply 3 amino acids. It's a tripeptide chain. But here's one of the things that comes up. Some patients would sometimes tell me, I'm allergic to glutathione. Is that possible? Is that like being allergic to water? Have you ever heard of such a thing?
So I've never come across anybody who's allergic to glutathione ever. Again, I've been using this product since 2007. Hundreds of thousands of patients have used this product over the years, and I've never seen anybody who is allergic to it. Now, when glutathione is introduced to the body for the first time, depending on how much toxic load you have inside your body, you may have some reactions or undue reactions that needs to be adjusted. But other than that, I don't see any concerns or any issues with glutathione at all so far.
Awesome. And that's been my experience too. If someone says, I had a reaction from the dose of glutathione I took, I exactly that. It's either toxins or infections, perhaps hidden in biofilm, that the glutathione is actually able to strengthen the body's immune system, help them move out some of those toxins, and then you're getting a result of the detoxification process. It's not that you're allergic to glutathione, which is simply just 3 amino acids.
Exactly. And it's an autologous peptide. That means your body produces internally. And yeah, well, if you think about it, autoimmune disease is what? Autoimmune disease is your body is breaking down your own immune system, right? It's internal. And so, yeah, body can have all kinds of reactions like those, but having a reaction to glutathione, I have not seen one yet.
Awesome. Yeah, and as you mentioned, part of many cases of Alzheimer's is an autoimmune reaction where the body's own immune reaction, the own immune system is attacking the microglia, macrophages in the brain, for example.
Absolutely. And I think it has to do with decades of inflammation, decades of things going wrong inside your body that's leading up to Alzheimer's. And Dr. Helman, I really admire your work because you are doing something that is a very, very difficult disease to treat, extremely difficult disease to treat. And it's amazing how physicians like you will devote your time and energy to help those people when you know there is nothing more, not a whole lot of things you can do to reverse a lot of things that has been done for 20, 30 years ago.
Yeah, no, like when I was in medical school, we were taught you can only diagnose Alzheimer's at autopsy and that there really was not a lot of hope. Well, that's why we're talking today. There is hope. And part of that hope, frankly, is what you've produced, this glutathione molecule, this glutathione topical roll-on approach. So let's talk about that. So I often tell patients they need to do glutathione first because I think it's a lot safer to remove toxins first before doing any other treatments, because the last thing I want to do is kind of in the example we talked about where you're busting up biofilm, you're moving toxins around, and people can actually get worse. Their memory or other neurologic symptoms can get worse. So my question to you is, what is the best form of glutathione to take? Or if you want to deliver glutathione, maybe you should be giving lots of different types of glutathione at the same time. What's your take on that?
One of the three things to improve glutathione levels in your body starts from reducing exposure to known toxins that deplete glutathione. For example, reduce your exposure to excessive sunbathing, chemical exposures, environmental pollutions, toxins, household chemicals. The worst of all is alcohol. Alcohol depletes glutathione levels to zero even with one drink. And so having all those things removed from your daily exposure or daily diet out of your system would be the first thing you should do. The second part that it's composed of 3 amino acids. So if you can just put in your favorite search engine or your AI robot that, hey, I want cysteine-rich foods, if you just consume those, it comes from cysteine, glutamine, and glycine. The other two are abundantly produced. And we can talk about glutamine more because that I think is one of the cause of having memory issues as well. So the thing is, if you eat cysteine, cysteine is one of those amino acids that is not commonly available in all your meals. So if you eat cysteine-rich foods, your body's going to be able to produce abundantly glutathione that it needs. Of course, it's not going to meet all the demands, and eventually, if those two are already being done, and I'm not saying that in place of those you do the third thing, but those two have to be done on a regular basis until the last day you die. The third thing you can add on is if you do need some help, a supplementation like glutathione topical spray that we have developed, because that's the first spray that is actually getting through your skin barrier, getting through your cell barrier inside your intracellular levels for the first time. And so by doing so, you are basically putting money in your wallet straight up so you can use them and go buy stuff that you want. I always like to figure out, I said, hey, if I need to buy something, do I need a bond or do I need a stock or do I need the money in my pocket? The money in the pocket is always the best choice because you can spend it today. Having glutathione in your cells is the best thing you can have because you can spend that glutathione right now and detoxify your body and get the body healthy.
Right. So you mentioned that alcohol is one of the biggest culprits because it will lower glutathione levels very low. But what's happening is the body is using its glutathione to detoxify, to keep alcohol, which is a toxin, from wreaking havoc on your cells. Is that right?
That's exactly right. Because as you know, alcohol is getting into your brain cells. Aldehyde is one of the neurotoxin that we do not want to have in our brains in the first place.
100%. And here's a question, because, different people vary on how well they can handle or not handle alcohol, and often because of genetics. So my question to you is, there are certain people with mutations, whether it's MTHFR or other types of genetic mutations. So my question to you is, are there some people who need more glutathione than others, or what are your thoughts there?
So that's a great question because the actual needs for glutathione is determined by the body's expenses. It's like, for example, if you ask me a question, say, hey, how much money do you really need to survive in California or New York or Idaho or some of the remote towns in the world, right? Everybody has different needs, right? Same thing with glutathione. Depends on your exposure to the known toxins, exposure to what you eat, exposure to other genetic mutations that you may already have. Like you mentioned MTHFR, there's other ones called COMT, then there's GGT, GSTM, GSTP. All these different variations in gene mutations can increase your needs for glutathione. And so what do everybody need? So when we did our own study internally, what we figured out that if you're otherwise healthy and have no other conditions or concerns, 4 sprays of the Glutaryl, which is about between 90 to 110 milligrams of glutathione, is enough to raise your level to high normal ranges.
And this is what it looks like, right?
Yes, exactly.
Yeah. And so you said 4 sprays. Now, your product comes in 2 different strengths, right?
Yeah. So this is, I'm talking about the regular Glutaryl, not the plus.
Oh, okay.
The plus is much stronger.
Okay.
So regular Glutaryl, 4 sprays is basically a complete replacement of glutathione with what your body needs. Now, this is for otherwise healthy human beings. As you know, we don't get healthy people coming to me all the time. They come to us because now, hey, doc, what can I do? I'm really suffering now. I wish people come to us early on, or if they're listening to this thing, I hope they start early on before they get sick, so that way they can avoid the problems in the future. But if the needs are higher, then of course we do the plus version, which gives you 175 milligrams of glutathione approximately in 4 sprays. And that is actually giving you more than what your body produces, but at this time your needs are higher as well. And so those concentration product is basically being used by a lot of our customers in temporarily, maybe 3 months, 6 months, up to a year. Once your needs have been completely met, your body's in a very good condition. They usually switch back to the regular Glutaryl for maintenance purposes because now their needs are average. they don't need high concentrations anymore. So yes, so that's what we do. We do it twice a day because it only stays in the body for 4 to 6 hours. Even though your body recycles part of the glutathione, like 50% gets recycled in a healthy human being. If you're not healthy, I don't know how much gets recycled. So regardless, we're just using it twice a day, and hoping that in over time, over 2 to 3 months down the road, your body's going to hit steady state where twice a day application is going to be sufficient to have a glutathione coverage for the rest of the day.
Got it. And you mentioned the dose, I think 175 milligrams, not to get too much in the weeds, but my understanding is that at least this formulation is a micro nano, meaning it's well, let me have you explain it. But the reason I'm asking the question is I'm confused because I've had people say, oh, this is a really small dose compared to maybe
Yes.
some of the oral or other. So it's not comparing apples to apples.
No,
This is your product. If you can explain
absolutely.
those issues.
So what I can give example is intravenous glutathione, because I think that would be the best way to do it, because you're injecting straight to the bloodstream. So intravenous glutathione, let's say you give 2 grams of IV push, which is 2,000 milligrams of intravenous glutathione. There was a study done in 1991. It showed that after following 2,000 milligrams of glutathione, 100% of the glutathione was in the urine in about 5 to 15 minutes. Literally, nothing went into the bloodstream. Nothing stayed in the bloodstream. What they found out was 90 minutes later, there was an increase in the bloodstream for cysteine. So the body was actually using the cysteine molecule to produce its own glutathione, and the production of the glutathione is not very high for the day. So, I mean, research has done given 1 gram, 2 grams, 5 grams, up to 10,000 milligrams of glutathione in an IV push, and the results are still mediocre at best. Okay, compare that to the topical form. Topical form, we have dual technology process in there. And that's why we have 8 patents on it for this molecule, the weights we deliver. Because the first patent was, how do I get to the skin barrier? Skin is a physical barrier, right? So the size might matter at that case. But size has nothing to do with anything except for getting through your skin. So when people say, oh, we are using nanoparticles, and if you're taking my mouth, well, I'm not sure what kind of pores are getting through your body that's going to get inside your body any faster, but it does not.
Right.
So,
and let's translate for the audience. So when we talk about nanoparticles, we're talking about nanometer, which is about the size of the thickness of a human hair. I mean, it's still very small, but am I right there?
The human hair is much bigger than nanometer.
Right.
When nanoparticles, we talk about it between 80 to 100 nanometers is nanoparticles, right? And so that's small, very, very small. And so that just gets through your skin. Okay, so that was my first technology.
Okay.
But that wasn't the problem. The problem was not getting through your skin because we were injecting it in the first place, and that was getting through your skin. But the bigger issue that we found out was a chemical barrier. The cell itself has a barrier where it cannot accept any peptides from outside sources. And so going through that barrier was even more difficult than getting through your skin. And so that comes up with second technology that we developed. We use sugar molecules and embedded the glutathione inside the sugar molecules. So the cells take sugar in the form of polysaccharides to help increase ATP energy inside your body. And so it just sucks it up from the cytoplasm or from the outside body and just takes it inside. Inside, when they get the sugar molecule, inside was glutathione stuck in. So when you get glutathione inside your cell like that, a small amount has a gigantic results in your body. And if it goes where it's supposed to be, the needs are actually very, 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 very small. And that's what we figured out. So I know it's a less milligram, but I'll assure you that even 175 milligram, which is the Glutaryl Plus, is too strong for almost a lot of people. And I don't want them to confuse that, hey, I can take any amount of glutathione I want and I'll be okay with it. No, the Glutaryl Plus is stronger version. you should be using it cautiously. I want to make sure people understand that just because little is better, more is not best, right?
Right. Let's focus on that. What is the danger of taking too much glutathione?
So the danger comes in from what it does inside your body. What it does is it helps detoxify. First of all, it quenches free radicals, which is easy. I can quench all the free radicals, and the body will say, "Hallelujah! Thank you very much for doing that. My job is done." But the second part of glutathione, it also is a master conjugator inside your liver. So it conjugates with different metabolites or chemicals, heavy metals, things like that, and it tries to eliminate them either through urine or through feces. Either way, it has to be out of your system. When that process gets activated to a level that your body has not seen before, the body may throw some curveballs. Say, hey, if your toxic load is in your stomach, then you may get diarrhea, you may get stomach cramps. If this toxic load is in your brain, because keep in mind, brain consumes 20% of all the oxygen that you breathe in. The highest amount of oxygen stress you have in your body is in your brain. And people that have a lot of toxicity in the brain, if you use the glutathione for the first time, you may get a headache. And if that happens, cut back on the dose because you don't want to go above and beyond what your body can tolerate. The third thing that happens not so often is fatigue. If people have generalized toxic load in the whole body, people with mold, biotoxins, people that have chronic exposure to fungus, things like that, those people may have an extreme fatigue issues. And if that happens, cut back on the dose, go slowly eliminate out of your system. And once you get to 4 sprays twice a day, that's when the benefits kicks in at within a couple of weeks. The last thing that people notice, which is quite common, is they get a generalized rash at the application side, right? I said, if they apply over here on the arms, they get a little bumpy and a little rashy over there. And all it's telling me is that it's trying to detoxify through your skin. Anything happens, stomach cramps, diarrhea, headaches, fatigue, rashes, slow it down, right?
Right, right. And to be clear, this is not an allergy to glutathione or something in the spray. More likely, it's the glutathione's working and you have to go low and slow and build up to the right dose.
For a lot of consumers, that is 100% true. But keep in mind that there are about 4 to 6 ingredients inside this product, and all of those ingredients, all of them, have been assigned GRAS status by FDA, generally regarded as safe. But the status is only applied if you take the product orally. Since this is topically, the same status would not apply to this product at all. But just rest assured, the chemicals that we use have GRAS status by FDA, so they're completely safe to use for anybody, young, old, pregnant, everybody.
Got it. So one of the side effects I've seen using high dose glutathione, say 5 grams intravenously, is patients can start getting sick to their stomach or throwing up. Have you seen that? And does that fit into a side effect of glutathione potential?
Yes, and that's the first thing I mentioned. It's either you get stomach cramps, diarrhea, things like that. It's sick of the stomach is definitely an issue. But keep in mind, 50% plus population have gut issues. So yes, so healing of the gut is very important. The glutathione will help heal the gut. And initially, is releasing all these toxins out of the gut, and that's what the problem is. It's the body can handle that much toxin removal at any given moment.
Wow. So one thing I've noticed is if I put the topical glutathione on an area of my body that's in pain, the pain level will go down. How in the world is topical glutathione reducing pain?
So we did a human trial about a couple of years ago. It was a 3-day trial. As you can imagine, we didn't do any animal studies. So when we went to the IRB for approval process for a human trial, they says, "Oh no, you can't do human trials. You got to do animal studies first." I said, "Well, wait a second. This is a GRAS product. Everybody, the FDA says this is all the chemicals that we're using is completely safe. Then why can't we do human trials? We're not using any brand new chemical in this at all. So it took us a year to convince the IRB to get a human trial done. So when we did that part, the only thing that sealed the deal was, okay, I'll let you do a 3-day trial. So if you do a 3-day trial, 3 days, what are you going to see in 3 days? Nothing, right? You're going to see nothing in 3 days. So I said, okay, fine, I'll do a 3-day trial. And so in 3 days, we were measuring the blood levels for everybody. So we saw the blood levels rise for glutathione in the blood cell, in the RBC level. So that was I knew that was a great win for us. But what the physicians did in the laboratory was they took the blood out in the test tube. They infected the blood with mycobacterium infection.
Ooh.
I said, okay, what? Let's see if you say that your glutathione is absorbing this fast, it's going to affect this fast. I want to see, does he have any effect on the mycobacterium infection? And sure enough, what they found out was the test tube there had the blood with the glutathione in there. The load of mycobacterium just went down within 1 hour. The other test tube where they had no glutathione in there, the mycobacterium infection was multiplying, was going up, right? The other one was going down, the other one was going up. So then the researchers right away says, whoa, this is crazy. 1 hour. So what they did was they started measuring the blood for all the cytokines, the inflammatory markers, the IL-2, IL-12, the TNF alpha, interferon gamma. They saw a rise on all the cytokines. So what it did was it was activating the macrophages, activating the phagocytosis of all this of all this infections and getting rid of the infections. So what two things it proved that day. One, the physicians already said that, hey, it has a major issues on the inflammatory markers, either pro or con, so it can help with inflammation. It was absolutely excited about to see that it was activating the macrophages, your own immune system to deal with infection, which even though it was in a test tube, wasn't even in the body. It was in the test tube. The body was already responding to it right away. Keep in mind, this was a 3-day trial. And of course, after that, it has triggered numerous research after that already. And so right now, the physicians, the professors are actually looking at more trials right now.
That's fascinating. That's really exciting. But here's a follow-up question. How do we know that the glutathione that you were studying wasn't also affecting directly the mycobacteria?
Well, the thing is, because we did not do that part of the study. What we did, what they were trying to figure out was it affecting the bacteria itself, or was it affecting the immune system itself, right? So we don't know what it was affected. We do know the load went down. We do know the cytokines went up. So of course, the conclusion is that, hey, your own immune system is dealing with the bacteria and not just the glutathione itself.
Right.
It could very well be glutathione too. We don't know that answer.
Right. And I'm asking because many of the molecules that humans use as part of our immune system and physiologically are also have direct effects on different types of bacteria. As you know, so that's just my curiosity. Interesting. And it sounds like we don't know the answer to that yet.
You don't know the answer to that one, because even before, a few years before that one, the same professors were actually using it for reducing the cytokine storm during COVID, during the first variant, 2020. And the same team of professors were actually using in the medical center the glutathione product to help patients just breathe better, right? If they breathe better, they didn't end up in a hospital. They had a chance to survive. And so they did that one. So that's what triggered them. I said, hey, you know what? If it's going to help with the cytokine storm and help reduce inflammation down and help have the immune system activated and help deal with the viruses at that time, they said, hey, we should also do a mycobacterium too. So 3 years later, they did a study on the mycobacterium infection.
Very good. So it sounds like the reason, in my case and in some of my patients, the reason why putting topical glutathione on the skin in an area where there's pain, it could be that the glutathione is decreasing the amount of inflammation in that area. But couldn't it also be that it's affecting the nerves in that area too?
It could be, but the only nerve study that I have done and that I've seen results with is anybody who has post-herpetic neuralgias. So anybody has nerve damage due to sinus infection. Those people had a tremendous benefit in reversing those conditions and being pain-free. For average nerve damage, I'm not 100% sure, because the nerve could be because there's not enough blood flow in there. There's some nicotine in the bloodstream someplace. Glutathione is not going to help with any of those things, because it's a physical barrier, not a chemical barrier. But yeah, for the nerve things is what we have seen is just what the neurology is.
That's so exciting. So you got patents on this, a couple patents on this amazing technology. In the back of your mind, have you thought about using this delivery system for other molecules besides glutathione, other peptides or things like that?
Absolutely. And that's what we do have a couple of peptides that are there in the research grade right now. One of them is very close to being perfected. So will be available to consumers pretty soon. We do have this product ready for the physicians to use it right now, which is called GHK, but it's not available to the public yet until we get some data coming from the physicians' offices first. So we are hoping that we'll have everything ready and launched by May or June of this year.
Got it, 2025. So GHK, what type of, I know it's still preliminary and who knows what it'll end up, but theoretically, GHK, how would that help people?
So it's one of those peptides that also helps with soft cartilage, helps with joints, helps with skin rejuvenation. So I've been using it for about a month right now, and I just did my scan for my face, and it's just a skin scan, right? It was just nothing crazy. And the lady goes, "Oh, are you been using any sunscreens?" I said, "I have never used a sunscreen in my life, ever." I said, "Oh my God, you have no sun damage spots." I said, "Great, thank you very much." I said, "Oh yeah, and your wrinkles are not there. My wrinkles on my lips are not there. My forehead is getting cleaner. There's a glow on your face." And the only thing that I've done in the last month was just a GHK. There's definitely some skin benefits to it. I'm still trying to figure all those things out right now. But the way it works is it's heavily into bones and soft cartilage and collagens and things like that.
That's really exciting. Next thing is, at the beginning, you mentioned something about glutamine. So glutamine is one of the 3 amino acids of glutathione. What did you have in mind specifically about glutamine?
What I see is I've been dealing with a lot of neurological disorder patients. Alzheimer's is one of them, then Parkinson's, ALS, Huntington's. We also see athletes with post-concussions, TBI patients, things like that. And one thing that the doctors has consistently told me is they have high levels of glutamine. And so to reduce the glutamine down, what you have to do is you have to eat diet full of cysteine. So whey proteins, avocados, cruciferous vegetables, anything that has cysteine in there, you got to eat that food to bind to glutamine and reduce the glutamine loads down. Because I was also doing a research on a cancer protocol, and patients with cancer, especially the liver cancer patients, have a lot of glutamine in their body as well. And so and sometimes the diet is not enough because they don't eat food. So in those patients, we are using something called NAC, N-acetylcysteine, and to help bind the glutamine and get rid of it. So we do NAC to bind the glutamine. We give them the glutathione supplementation to improve the glutathione levels inside your body. So it's as a double combination, it's really, really beneficial for those patients to eliminate the toxic load, reintroduce something that is good for your body, and hopefully help you detoxify.
That is so exciting. So again, NAC, N-acetylcysteine. How are you recommending people take NAC? Is it an oral supplement?
Yeah, it's cheap. Oral capsules, like 600 milligrams once or twice a day is plenty. If you eat the foods, you get plenty of cysteine from the foods, especially those whey proteins. Brazil nuts, I love Brazil nuts. 4 Brazil nuts per day will get you enough of those as well. Things like that. So if you just eat cysteine-rich foods and supplement maybe a one or 2 capsules per day, it should be plenty.
Okay. And let's talk more about glutathione delivery, because this is, to me, been one of my biggest frustrations trying to detoxify patients is patients may take a bottle of oral pills of glutathione maybe not even lipophilic, and then they're like, I don't feel any difference. So so go over other ways to deliver glutathione and some of the pitfalls around it.
Absolutely. So if we just put in your favorite search engine, glutathione products, you probably find 1,000 different products in the marketplace today. From injections, which is doctor's offices, but besides that, there's capsules, there are liquids, then there's mouth sprays, there are patches available, there's soap bars, skin lotions, all kinds of things are available as of today. But here's one thing. There was 2 studies done, right? So the one we already discussed about the IVs. The second study was done on what we consider is the most powerful glutathione product, which is liposomal technology, which is supposed to be nanosized particles of glutathione. So 2011, University of Texas in Austin did a study on liposomal products on 26 autistic kids. So what they gave them was 13 kids got oral and 13 kids got topical glutathione in the liposomal technology. What they found out was 100% of all the kids did not see a rise in glutathione levels immediately. What they saw was a rise in the amino acid cysteine. And later on, maybe 6 hours later, they saw a rise in glutathione levels. Of course, if you are the company who sells those products, you think, hey, what do I care? The body levels of glutathione has increased. My product works, right? I said, yes and no. Just because it improves glutathione levels 6 hours later, that does not mean that it can absorb. The reality is that the body made its own glutathione by the cysteine that was being absorbed from the glutathione itself. So the body breaks it down, absorbs the cysteine, uses cysteine to produce its own glutathione. And if you think about it, FDA in all these years, 100 plus years, has only approved one product to improve glutathione levels, which is NAC.
Right.
NAC there's a brand name called Mucomist.
Right.
Is the only approved product in the world that improves glutathione levels.
Right. And I would use Mucomist in the emergency room.
Yeah.
You put a mask on and our patients would breathe it in. So I'm very well familiar with it. It works wonders.
It works wonders, right? What we found out was in the last 15 years, there's a very small subset of people that does not work. And if you figure out who are these people, right? And thanks to the gene testing, we just mentioned earlier about the MTHFR, COMT, there are people out there that have GSTM, GSTP, GGT. All these gene mutations are directly correlated to producing glutathione. And you may not be born with it, but over time, there's a gene expression that happens. And if that happens to you, all of a sudden, your body stops producing enough glutathione. When it does that, you just go downhill really, really fast, right? How do you know that people was so healthy and all of a sudden got a disease and died in 2 years? It happens all the time. And we just don't think about it. I said, oh my God, what happened to this person, right? When we do not know what happened. So today, what we are finding out, a lot more people are not able to conjugate. So you can give all the cysteines in the world.
Right.
And glutathione levels still not rising. So there is a need for a product that actually improves glutathione levels and bypasses your human barriers. But if you are an average person that you have no idea what your gene mutation is, and if you don't spend thousands of dollars to get this testing done, you can literally buy the glutathione products today, the topical spray, and improve the levels immediately. Anyway, that's what I've seen so far.
So let me just clarify. So what you're saying is if you take the oral glutathione, that product may also increase your cysteine and lead to increased glutathione levels in the body 6 hours later.
Yes.
But and how does that compare to the topical product?
So here's a comparison. So if your body has to make glutathione, it can only make it based on 3 things. Number 1, does it have the 3 amino acids? Glycine, glutamine, cysteine. If you have abundance of those, number 2, it requires the 2 enzymes to conjugate them. If you have enough enzymes, you can produce enough glutathione. And number three, it needs 2 molecules of ATP, energy source. So as you get older, your enzymes in the body decreases a little bit. The energy in your body decreases a little bit. The mitochondrial numbers of mitochondria in the body also decreases a little bit as well. And so over time, your body's ability to produce glutathione drops down dramatically. You can take any product in the world, cysteine or glutathione products that our body breaks it down. It doesn't really matter. The body's only going to produce enough based on what's the lowest amount he has of either energy, enzymes, or the amino acids. So all three have to be there in full concentrations to body to produce enough glutathione. And as we age, those two keeps on going down. So if you're 80 years old and you have low energy, your body doesn't have enough enzymes in there, you can take all the NAC in the world, you can take all the supplements in the world, and your body's not going to produce enough. So for those folks, the Glutaryl spray it's an absolute must because they will have the full levels of glutathione. I don't care what age you are at. I'll get you high normal ranges immediately, so you can feel the difference immediately.
Right. So just to be clear, with a spray like this, you're going to have immediate raise in the levels. You don't have to wait 6 hours to potentially manufacture those higher levels of glutathione. Is that my understanding?
Exactly. So you're bypassing the own body's ability to manufacture it. Whether it has it, doesn't have it, doesn't really matter.
Cool. All right. So my next question in terms of ways to deliver it, what do you think about, there are products out there that are like, sprays. You spray the glutathione in your mouth and hopefully absorb it in your mouth. What are your thoughts on spray glutathione?
It's the same one. It's the same thing as the liposomal technology products. They all work to a certain extent because the body will break it down, absorb the cysteine, and use the cysteine to be producing your own internal glutathione. So it doesn't matter if it's a spray. And once it goes inside the mouth, it gets broken down. Even my product, if you put it inside the mouth, it does work a little bit, but I know it's getting broken down because I did the blood test with those products as well, and the levels are not rising high enough for me.
Interesting. So again, based on what you're saying, you like the topical approach. Are you against intravenous? Because I've had really good experience for 6 years giving my patients IV glutathione to help them detoxify. Are you opposed to me using intravenous glutathione?
The detoxification is a marathon, not a sprint. It's slow and steady every single day, day in, day out for 6 months, a year, 2 years. It will get you much better results than trying to do an IV push once a week, once a month, a very heavy dose, and hopefully the body doesn't react to it. And so if it's myself or my dad, my mom, my family member, I would probably take a stand and use a topical version day in, day out, twice a day, every day. And if you really want to speed up even further, you can do it 3 times a day. I don't care, right? As long as you don't get any rashes from it, you can do it 3 or 4 times a day. That's not an issue as well. But that will give you more benefit for sustained benefit without having any issues. And if you can get that done, then there will be no need for IVs anymore. That was one of the reasons, because we were one of the largest producers for intravenous glutathione for 20 years. And we shut it down because I did not see a need going forward that, hey, if people just do the topical version, there might not be a need of intravenous glutathione. Again, I don't know that right. So the glutathione can be used, let's say, for example, if you're doing chemotherapy with cisplatin. Platinum drugs are very, very toxic. And you have to get rid of those toxicity out of your body like really, really fast. So in those cases, yes, you can use intravenous glutathione after the chemotherapy, because that will bind to all the platinum out of in the drug and try to get rid of it.
Right. So you're basically inactivating the chemotherapy agent as soon as possible.
Not inactivating the chemotherapy; it's inactivating. It's basically binding the platinum in the drug itself.
Interesting.
So yeah, so the FDA, I think, has given us a compassionate use approval for glutathione for cisplatin-induced toxicities.
That's awesome. So what about, and I know this is controversial, but I get asked this question on a weekly basis, so I'm going to ask the expert. I'm going to ask you, What about using glutathione in cancer patients? What I tell patients who have active cancer, I tell them be very careful with glutathione because my concern is if you take glutathione and you've got active cancer, that potentially the glutathione is going to benefit the cancer cells and help them detoxify. What is your opinion?
So yes, this is a very tricky question because we do not know all the answers as of yet. So, uh, being said that, we do work with a few oncologists, and I've been very cautious in recommending the product because I usually don't recommend the product by itself. For sure, not a recommendation in place of chemo ever. Uh, if you're taking glutathione by itself, is it going to help with cancer? The answer is no. But here's the thing: cancer cells have glutathione. They don't produce glutathione. What they do is they hijack your own mitochondria and basically confiscate all the glutathione production that we have inside the mitochondria and just takes it away from us. If using a topical product from outside sources enters the bloodstream, enters the cells, doesn't get into the mitochondria, but it enters into cellular levels, the body senses, hey, I don't have to produce any more glutathione because I have plenty of it. So in theory, this thing can potentially stop the production of your own glutathione and starve the cancer cells, right? Again, this is all theory because nobody's ever proven this part yet. So that's what I tell all the oncologists is, hey, why don't you try it out? And if that works out better for your patients, then you can use it. If not, doesn't work out, then don't use it. I always suggest if you're working with cancer patients, work with oncologists. If they say that no, drug is glutathione, there's nothing I can do to help you with that at that point. But the oncologists that we work with, what they're using it for is concurrently with chemotherapy.
Bingo. Okay.
And so what they're doing is that, hey, they're giving a high-dose chemotherapy. They know it's very toxic. They know they had to detoxify all the chemo drugs out of the system, and they're using glutathione concurrently with all chemo drugs and helping those patients. Especially even few days ago, I got a call from a very big hospital in California, the biggest cancer center, and one of the leading surgeon over there, his best friend calls me up and said, hey, I need to figure out, can I use this product on a liver cancer patients because they're going to die anyways, and I want to try to figure out. So they are right now, they're looking at doing a clinical trial right now. That's where I learned about the glutamine is very high on those cancer patients, and they're using NAC to bind the glutamine. But in doing so, it's not helping the cancer; it's just helping reduce the glutamine down. So even though the glutamine is reduced, it's not helping the patient a whole lot. And so they're hoping that they can do both, reduce the glutamine and give the glutathione and see if that have any results. And normally, I have few patients that have used concurrent chemotherapy, and they were able to tolerate the chemotherapy. They're cancer-free today. They are loving it. They're enjoying life even today's date. And so I'm happy that something like this helped them a lot. But this requires more further research. And as of right now, I cannot recommend to everybody unless they work with somebody professional to help them guide through the process.
Perfect. You need to find an expert. So, for example, I've talked to oncologists who are actually injecting glutathione not into the cancer, but into the surrounding tissue to strengthen the surrounding tissue to hopefully fight the cancer itself. But again, this is different than just putting topical glutathione and increasing the glutathione concentration in your whole body.
Yeah, so if you inject it around the cells, the unfortunate part, the injection doesn't get inside the cell at all. So it's not really protecting the cells surrounding the cancer cells. So having a topical versions around the cancer cells is far more superior way to enhance those levels. Because keep in mind, cancer cells does not have those lipid rafts for communication, and that's a system we use to deliver the glutathione. So it's not going to feed the cancer cells; it's only going to feed the healthy cells.
Oh, interesting.
Yeah.
Depending on where the cancer is located, I guess.
Yeah, well, it doesn't matter. Where the cancer is. You can have a liver cancer apply on your arms, and it will protect all the body, because when you do chemotherapy, it's attacking the whole body, not just the cancer cells.
Wow. All right. So here's another question: what about inhaled glutathione?
Okay. That's a great question. That we didn't just. So let me talk about a few more delivery systems.
Sure.
There's inhaled glutathione. There's a suppository glutathione, and I'll talk about both of them because I have a very famous football player. He's a Super Bowl MVP for quite some time, retired now. For 10 years in his life, he was using glutathione inhaled. Okay, uh, and then he learned about the topical version when his father was having COVID in 2020, and somehow the doctors they were working with recommended my product and literally saved the father's life in the hospital. 7 days later, the father was home, and it was just like, oh my God, what the heck happened? Right? How did he survive? And so I get a call and said, hey, I've been using inhaled glutathione for 10 years, and I heard about this topical version. Can I try some? And of course, at that time, all the NFL players were in a bubble, so they couldn't leave NFL, so we had to ship it to them. The product got to him. We used the product. In 30 days, as you can imagine, I said, I've been using it for 10 years. What I felt in the first 30 days was more profound than the 10 years what I feel with inhaled glutathione. And of course, right off the bat, can I get a dozen more now? This is it's like everybody needs it now. It's like crazy, right? And so that's the story I have about an NFL athlete that was using inhaled from glutathione. I have made inhaled glutathione for COPD patients, cystic fibrosis patients all my life, and I'm telling you right now that the topical versions get you more better penetrations than anything else that's out there right now. I even stopped making inhaled glutathione for all my customers as well.
Okay. And just to go there, because you said that you actually want to build up to, say, 4 sprays. I'm assuming you're not spraying the same area of your arm or whatever body part 4 times. You're doing other areas, or do
No,
you spray and
similarly.
wait? What are the nitty gritty details? Because I don't want to see people spraying it and it just drips off their arm and it does no good.
So I basically I put all 4 sprays in one area and just rub it in. So I put 2 sprays, rub it in, two more sprays, and keep on rubbing it further down. So myself personally, again, my habits are very difficult because I have a lot of stress on my mind. I'm always traveling, always speaking, always
Yes, you are. I could testify to. I see you like every week, but in a different city, so I could testify to that.
exactly. And so my needs for glutathione actually are very, very high. So I would use 12 sprays at home twice a day. When I'm traveling, I'll probably go to up to 18 sprays twice a day. When I do feel under the weather sometimes, I'll probably use 4 sprays to 6 sprays every 4 to 5 hours, like 3 or 4 times a day, 5 times a day in one day. And by the second day, I'm back to normal. So I'll use all those different variations, but I usually apply on the same area. Like if I'm applying 12 sprays, I'll usually go on my belly because I have a large surface area. Just rub it in, rub it in. It takes about 2 minutes to get through the whole belly until it's completely dry. But yeah, 4 sprays on your arm it should not roll off. It should not roll
Okay.
off. Just rub
Just
it in the same spot.
to,
But you're right. It may get rash. So if that happens, then rotate the sides.
right. And what I notice is right when you do it, it gets sticky, probably because of the sugar molecule in the spray, but that seems to go away within a few minutes.
There's a smell to it, which is a sulfur smell. The stickiest is it's the polysaccharides, the dextrin molecules that are a little sticky, but everything should go away. I was talking to somebody else yesterday, and they said the same story. I said, you know what? The first couple of weeks, the smell bothered me, but today, the smell is actually my body's craving the smell now. It's like they say that I want the smell. It's like the body associates good things and bad things, right?
Right.
When it's something is bad for you, it smells really bad for you. But then once you feel good with the same smell, the body actually craves it. And so he was telling me the story that he's been using for at least 4 or 5 years now. And he was telling me that the first couple of weeks it was a little bit hard for him, but today he says that I love it because if as soon as it's sprayed on, I feel refreshed, I feel energized. The smell itself gives me calmness to my mind right away.
Right. And the smell is from the sulfur part of the cysteine, right? Is that right?
Yes, exactly. Cysteine is the thiol group. It's a sulfur group. It's not a sulfur drug, so don't assume that if I have a sulfur allergy that I cannot take this product. No.
Awesome. And what another delivery method? What do you think of a light patch. I don't know if you've seen these of glutathione using light therapy for, I guess, the frequency of glutathione. What do you think of that?
So there is a doctor up in India who has a technology, a patent technology to see the frequency of glutathione, and he's using the frequency to actually do brain mapping studies. So we are working with him right now as we speak, and he puts the body in the MRI scan, and he measures the glutathione levels in your brain where it is by the frequency, right? Light, to me, I have no idea. So I know those patches are available. They seem to increase glutathione levels. It's probably a stimulant. Probably help you detoxify a little bit by some light therapy. But honestly, I have no idea how it works and why it works and things like that. I'm a very simple guy. I give a product, I do a blood test, my level goes up, I know it works, I'm done, right? Versus take a patch on and it's going to work. Trust me, this is a quantum light theory, whatever that is. I have no idea. But I have patients that have used those patches and they use my product and they see relief rather instantaneously.
Wow. So I know like me, you go to lots of conferences. What excites you about this field, about glutathione? What in terms of like the next 6 months? You know, if we were having this conversation 6 months from now, are there any new technologies or twists that you're working on or that you're aware of other people are working on that excite you, that make you want to wake up in the morning and produce more products and spread the word? What's exciting you in the glutathione field right now?
So like everybody says, right? If you have enough stuff in the world, uh, it gets boring, right? If somebody has private jets, big houses, big cars, guess what they do now? Oh, they can have a second private jet, second car, second house, and that's not enough. It's not going to make you happy at all. What makes me tick every single day is helping people achieve the best life for themselves. I get up every day and I do my daily gratitudes in the morning. I thank people that have helped me until now, and I'm praying for the grace that I'm here for long enough to so that everybody on this planet have a chance to get healthy one day. We know what the environment is. It's not going to get any better. It's just going to get toxic further. And so my hope is that I want people to get healthy. So only way I can do that is teach them, educate them, show them what I did. I can only say so much. I have to practice what I preach. So I can tell you that I'm alcohol free. I don't drink any alcohol whatsoever. I limit my sugar intake completely down to bare minimum. My exposure to sun is there, but it's very minimal. I do breathing exercise. I do hyperbaric chambers. I do stretching and yogas and everything possible for me to allow my body to heal by itself. And the only way the body's going to heal is if I bring the oxidative stress down to zero. And so that's what ticks me every day. I said, I'm get up in the morning. I answer emails to all my patients and customers. And as you can imagine, there's a lot of those every single day. I personally take time to educate people, and I personally go out to all the conferences and teach doctors. And I mostly go to all the doctor conferences. I do some consumer shows as well, but mostly physicians, because I think I have a better impact if I can have a lot more physicians learning about this process as well, as much as I do.
That's so exciting. Now, I tell my Alzheimer's patients, glutathione is your friend. You need to take glutathione on a daily basis the rest of your life. Do you give similar advice to Alzheimer's or other patients with chronic conditions?
So for me, it's any chronic conditions, you are stuck for the rest of your life. If you have a chronic conditions and if you're over the age of 40, the rest of your life, if you're between the age of 30 to 40, you have a chance. You have a chance for still shape up and do the right things so that allow the body to basically help self-heal itself. Let me give you an example. You came home with a bag of groceries. Both the hands are full. You open the door and you put the groceries on the kitchen counter. But the door left open. So what happens, the wind comes in, blows all the leaves, the dirt, the sand, it comes inside your house. So what you do is, like a good good person you are, you'll pick up a broom or a vacuum and start cleaning the house. But the house will never get cleaned up because guess what? You forgot to close the door. And so the body is similar. The door is oxidative stress. You've got to close the door first. That's when the glutathione comes into play. You got to close the door. But just because you close the door doesn't mean the house will get cleaned up by itself. No, you still have to clean up the house, right? You still have to clean up the house. You take a broom and you sweep everything around, and you make a pile of dirt. That dirt has to be outside your house now. So the glutathione helps both ways, closes the door for you, and once your body cleans up the dirt, it takes the dirt and dumps it out for you. And so glutathione is by far the most important thing for you, for closing the door and taking the dirt out. But if you don't have enough tools to clean the house from inside, you'll be out of luck, right? So when you're young, you have stem cells to clean it out, right? That's why no matter what happens, you can break a bone and from 6 weeks later, you're completely healed with a brand new bone. You break a bone in the 80s, and all you're going to say is, okay, make plans for a mortuary now, right? It's crazy. It is crazy. And so I want people to understand that glutathione is by far the most important thing, to take the dirt out and to close the door. But you still need to have your body's immune system built up completely to clean up from inside. So having a proper diet, exercise regimen, reducing exposure to toxic chemicals and pollutions and things like that. It's a given for you guys. It's not even like, you should do it for 6 weeks or 14 days. No, it's lifelong. So that's my story for everybody. I hope everybody gets the message loud and clear that this is by far the most important thing you can do for your life besides water and breathing air. I have nothing against drinking water and breathing air, because if you don't do any one of those two things, there's a finite time you'll survive. Without air, maybe minutes, you'll survive. Minutes. Without water, I don't know, few days at the most.
At the most, yeah.
At the most, right? Without the glutathione, it's maybe a couple of years. But there's a timeline of how long you can survive without these products. And glutathione is by far the most important thing.
Wow. This has been an amazing interview. Is there any question I should have asked that I forgot?
You didn't ask me a question, but I would like to share a story.
Sure.
So this is a story about my father. At the age of 78 or 80-ish, he had a mild infarction of his heart. It was scheduled angio, and he found out his main artery was completely blocked, 99% blocked. The doctor goes, "Oh my God, how the hell did you survive?" Right? Anyways, so they put a stent in there. He didn't have cholesterol issues. The doctor prescribed all kinds of cholesterol medications and every single thing, like the normal things they do in the hospital. My dad refused to take any medications. He didn't take any medications. And about the time, we had the glutathione discovered in the lab. So he was my patient number one. He says, "Hey, Dad, just take this product. This is glutathione. We just discovered this thing. It should be good for you." And like everything else, I was too busy doing my own work, forgot to check up on my dad.
It
2 years
happens.
later, so 2 years later, I was watching him eat one day, and he was pounding on sugar. And keep in mind, my dad was diabetic for 35, 40 years before that. He had arthritis for 35, 40 years, and blood pressure issues for that long. He was not in good health, and he was pounding on sugar. I says, "Dad, what are you doing? It's just too much sugar." I said, "Oh, no, son, this is good. My sugar is under control now." I said, "What?" "Yeah, my sugar is under control. My sugar level's been good for almost a year and a half now." I said, "Okay, I don't believe you." So I said, "Okay, show me a blood test." Of course, he had the blood test on his phone. I looked at the results, and his A1C was like 5.4 and 5.2. And I said, "What the heck?" I said, "How is this possible?" Anyways, so I said, "Okay, don't worry about that. Your sugar's looking good right now. But, please continue walking at least 30 minutes per day. Do not stop walking." 30 minutes? Here. He was so proud of him. Put his app on me. Look at this. I walk 6 miles per day.
Whoa.
I said, "What?"
After a heart attack.
He was walking 6 miles per day. This was 2 years later, but still,
Okay.
walking 6 miles per day. I said, "What?" I said, "This is crazy. This is nuts," right? And so he has like 2 or 3 groups of friends, because the friends will walk for a little bit, they'll drop off, and the other friends joins him. He just keeps on walking like an energized bunny. And so he started enjoying life at the age of 80. Went on every vacation with us. And wherever we go to Yosemite National Park for hiking. He was with us. We went to the Big Island, Hawaii. He was with us. We went, no matter where we went, he always told us to say, hey, wherever you go, take me with you. Because I would do everything. We went to Costa Rica. It was an all-adventure trip for my whole family. He was with us. Long story short, he lived a very, very good life, starting at the age of 80 after an attack. And then about 4 years later, he comes to me and says, you know what? My knees are killing me right now. I have no pain, but I'm walking a little wonky right now because of arthritis. It was deformed completely. So when the doctor goes, looked at the x-ray and said, oh my God, how the hell can you even walk? It's like completely deformed, right?
The joints, yeah.
I said, okay, knee replacement. So dad goes, yep, let's do both of knee at the same time. And the doctor laughed at him and said, oh, you're 84. We can only do one knee at a time. Dad goes, no. If I don't do both the knee at the same time, I'll never come back again. Right? It was so painful. I'll never come back. I heard the story. It's very painful. I will never come back again. I said, with both knees at the same time, you will be completely disabled for 6 months. And if you don't recover correctly, it's a major, major issue. Right? Dad goes, I'll take my chances. Tell me what to do to prepare them before the surgery, I'll do it. So he was told to bicycle 30 minutes per day. And of course, he's an overachiever. He will do twice a day, 30 minutes, twice a day, walk 6 hours per day, all those things. His quads are getting very, very strong. The doctor did the surgery. 2 days later, he was walking outside the hospital. He was walking.
2 days.
The nurses call him Superman, of course. He just says he came home. Of course, it was painful. It took him about a month to basically start walking a whole block around his house. But the doctor said, just take it easy. It takes you about 6 months for recovery. 3.5 months later, he was in India, traveling again.
Wow.
Packed up his bag and just left, right? He went to India. He went to Africa. He went to anywhere he wants to go, he just left. So the reason I'm telling the story to you is because until 80, he was obese, mild infarction. That means his heart was already given out, he couldn't even walk. Diabetes for 35, 40 years. Arthritis. Was he just surviving or living his life? He was surviving. He was just surviving, right? Like every human being. After that, he started living his life. Like he went on vacations every year. Every year he went to India and Africa. Every year he traveled the world. He went to wherever he wanted to go until last year. Last year, he was still in India, traveling the world. Here's a house right by the ocean in one of the remote parts in India. He loves his foods, of course, you know. He was eating some street food that day because my mom passed away 25 years ago, so he was by himself. So he traveled the world by himself, by the way. I don't know if you know this.
Wow, by himself.
At the age of 89, he was traveling the world by himself.
That's great.
So he was out there eating some street food, street foods. He got some loose bowel movement, some diarrhea. 2 days later, he got some lightheadedness and bam, fell down. Broke his skull. I get a call right away from the hospital. Hey, Dad's fallen down. He's broke his skull. But Dad FaceTimed me and said, oh, no, don't worry about it. I'm fine.
I got this.
Yeah. Look, his memory was perfectly intact.
Oh, wow. Okay.
His cognition was really good. He has no loss of memory, nothing. Of course, I know the neurosurgeon over here at NFL. I called him up right away. I said, hey, my dad just fell down, broke his skull. And I said, hey, is he coherent? I said, yes. His conscious is coherent. He's no loss of memory. His eye contact is great. Everything is good. Oh, that's a very good sign. Don't do any surgery. Do not cut it open, nothing like that. We're in India. As I told him the address, I said, okay, give me an hour or so. Within an hour, he arranged somebody to go see him in India. Literally. And the doctor said to me, hey, you know what? He's good. If he can survive the next 3 or 4 days, I'm sure he'll be okay to come to the United States again. And so my dad heard that. So I told him nothing's wrong with me. Everything is fine. Don't worry about it. He FaceTimed all of us, the whole family, talked to everybody. Said, okay, it's getting late now. I'm going to go to sleep. I'll talk to you guys tomorrow. Put his phone down, goes to sleep, never wakes up again. And I tell this story is because I want to give the hope to this 80-plus-year-old people that it ain't over. It ain't over yet. My dad, who was at that age with all these conditions, there's no chance for him. Forget living. right? Even surviving. He went from survival to living his life. The last 10 years, he left this planet on his own terms. He was the best place that he could be. He got picked up on the last day from this earth without any pain or any suffering. He was in the hospital the last one day, but there was no pain because there's no pain receptors in the brain, right? So it was pain-free. He talked to everybody, communicated with everybody. Even today's day, we don't feel that he's gone yet, because the memory we have about him is that he was a very fulfilled person. He enjoyed his life. He enjoyed everything he wanted to do. Whenever we book vacations, we always book tickets for him too. And now we remember us, we only book one less ticket now,
Wow.
right? So I want to give hope to everybody that's out there, that want to make sure that, you know what, God has given me the gift to help people. Allow me to help you.
Wow. So yeah, so it sounds like your dad lived a full life, and glutathione was one of the key tools that helped him do that.
That's the only thing we did different in the last 10 years of his life. The only thing I did different. There's nothing else I did extra besides that.
Wow. This has been such a powerful interview, Dr. Patel. How can people get in touch with you if they want to reach you?
Absolutely. So aurowellness.com, AURO wellness.com is my website. There's an Aura skincare as well. If you like to see the head beauty's inside out, I can also help you with the beauty as well. So Aura skincare, the same technology we're using for all the skincare products as well for you guys. My urge is to try it for 30 days. See if you can see the benefit that I've experienced in my family and my customers over the last 15 plus years. Subscribe to my newsletter, and I'll sure to educate you on an ongoing basis.
And can they find you on social media?
Social media is at Oro Wellness. On LinkedIn, you can connect with LinkedIn as well if you want to. But yeah, social media platforms, I'm there on all of them.
Thank you so much, Dr. Patel. What an amazing time.
Thank you very much for having me today.